have around a quarter of children at the age of 10 leaving primary school living with obesity.
It's costing about £58 billion to our economy to address the issues of overweight and obesity.
By 2035, type 2 diabetes, which is just one condition caused by diet, it's estimated that it's going to cost more to treat than all cancers do today.
I'm just an 18-year-old from Birmingham. There's not a lot I can do on my own. We need the government's help to protect us.
Welcome to this podcast about the evidence heard by the House of Lords Committee on Food, Diet and Obesity. I'm Baroness Joan Walmsley, the committee chair. The House of Lords Committee is a part of the UK's Parliament and listen to experts from all over the world in order to give non-partisan recommendations to the government. The Committee on Food, Diet and Obesity was appointed in January 2024 to understand how things like ultra-processed foods or those high in fat, salt and sugar affect our health and our lives, and how the government might help. We published our report and recommendations to the government about action we think they should take in October 2024. The government's response is expected to be published by the end of January 2025. We've pulled together some of the evidence from many of the experts we heard from into 2 podcast episodes to go alongside our report. In this first episode, we're going to hear about how the UK, along with many other countries around the world, is facing a serious problem, one which inspired this inquiry.
The threats from food now completely dominate the health of our population. It is by far the biggest cause of avoidable illness.
Former UK government food czar and author of the government-commissioned National Food Strategy, Henry Dimbleby.
If you look at the number of people who are out of work, 2.8 million people long-term sick, the Treasury thinks that the 4 biggest conditions that are driving that are type 2 diabetes, musculoskeletal problems, hypertension and mental health. And 3 of those are directly caused by diet, and one of them, mental health, is exacerbated by diet. So I don't think it is exaggerating to say that this is going to be one of the huge problems facing society over the next 10 years.
As Christina Vogel, Professor in Food Policy at City University, explained, this is a recent phenomenon.
The Health Survey for England shows that rates of obesity have almost doubled over the last 30 years, from 15% in 1993 to nearly 28% in 2023.
And it starts very young. Lucilla Poston, Professor of Maternal and Fetal Health at King's College London.
Through our very comprehensive National Child Measurement Programme, we know now from 2022 to 23 data that when children go to school, nearly 1 in 10 are already obese. 9.2% of children, when they go to reception classes, are obese. By the time children get to 10 to 11, 22.7% of children are clinically obese, and then the evidence in the academic literature suggests that obesity then tracks through to adulthood.
It's also a problem that's getting worse.
The deterioration in our health over time has been speeding up.
Executive Director of the charity, the Food Foundation, Anna Taylor.
We used to call type 2 diabetes late onset diabetes. It was never seen in children before the year 2000. In the year 2000, the first 8 cases of paediatric type 2 diabetes were recorded. We now have over 900 cases.
And the UK is worse affected than other European countries, as Dr. Chris Van Tulliken, Associate Professor at University College London and author of the book Ultra-Processed People, explained.
Compared to their counterparts in Eastern Europe, in Northern Europe and in Scandinavia, children in the UK at the age of 6 are around 7 and 9 centimetres shorter. And we know that obesity and that malnutrition, that stunting, is driven by diet.
We heard plenty of evidence then that the UK has a huge and growing problem that is leading to increasing amounts of sickness in the population. The experts we heard from also agreed that the current food system we have is clearly the cause.
The food industry couldn't be any more influential in terms of driving health outcomes, because we know that diet is one of the leading causes of ill health and the main contributor to obesity.
Eric Robinson, Professor of Psychology and Public Health at the University of Liverpool.
Consumers are completely reliant on the food industry when they're out and about and often eating at home as well. So really the food industry determines to a large part what we eat, and they shape our food environment. Everybody in obesity public health research kind of agrees that the reason we have an obesity problem now and we didn't 40 years ago is because the food environment's changed.
Even those within the industry agree. James Mayer, president of food manufacturer Danone in the UK and Ireland, explained how food manufacturers have got into this position.
At the end of the Second World War, the food industry at scale in the UK was challenged to do two things. One was to feed a growing nation, so plentiful supply, at a reasonable cost. And I think if we look back over the last 70 years, arguably, it's done an outstanding job in feeding a growing Britain. Of course, sometimes there are unintended consequences of those things, and I think it's fair to say that as a nation we consume too much product which is high in fat, sugar and salt.
One of the most worrying problems we heard about, though, was that the health issues related to our diets are now being passed directly to the next generation. Many babies and children today are starting life with obesity and face little chance of then escaping it. We wanted to hear from experts what was going on. Hearing that in the UK, children are suffering with obesity and other food-related health problems before they reach primary school, we wanted to start by understanding what causes obesity at such young ages. Could it be the genes? Professor Poston from King's College London.
The genetic contribution, in my mind, is quite small. The major contribution is the actual increase in poor diets amongst pregnant women. There are figures suggesting 20 to 40% of obesity in children is attributable to the BMI of the mother. There is a straight line relationship between the BMI of the pregnant woman at the beginning of pregnancy and obesity in her child. It's absolutely dramatic. So we're incredibly concerned about the fact that more than 20% of women antenatally are obese, clinically obese. It's following the trend in the general population. If we were able to modify that, we would be able to modify childhood obesity.
This is a very important finding from research. It means that it is possible to protect children from this very poor start in life.
The key thing is that obesity tracks through life. So it's so important to recognise this opportunity that the early years creates.
Dr. Vicky Sibson, Director of First Steps Nutrition Trust, explained how that could be achieved.
There's a wealth of evidence that shows that at a population level, breastfeeding protects against overweight and obesity, while bottle feeding and formula feeding has been associated with excess weight gain. So breastfeeding is a responsive behaviour. You can't force a baby to breastfeed. They can follow their own satiety cues, and they'll latch on when they want to feed and they'll stop when they're satiated. Whereas bottle feeding, you can bottle feed responsibly, but it's harder. And some of the evidence shows us there's a tendency for parents to want to finish a bottle.
Dr. Sibson stressed the importance of supporting mothers and mothers-to-be.
It's not about focusing on these individuals and their choices and their behaviours. It's about creating a more enabling environment so that women can start their pregnancies at a healthy weight, so that they can meet their breastfeeding intentions, because most women want to breastfeed. A lot of women start breastfeeding and then their intentions are derailed by the environment in which they're trying to breastfeed.
Dr. Sibson talked through how a mother might end up giving up breastfeeding earlier than she'd like.
There's different reasons for that, but one of the key ones is probably exposure to formula marketing, knocking her confidence to breastfeed. So an example would be she might have signed up for a baby club from one of the formula companies, and it's a perfectly legal type of marketing, but within those emails there'll be messages that are making her doubt her self-efficacy to breastfeed. And it's also evidence that introduction of formula does hasten the end of breastfeeding, so her breastfeeding journey will be shorter than she would have wanted it to be. So then, fast forwarding, at 4, maybe 5 months of age, she'll probably start weaning. And that's important because that's earlier than the NHS recommends. It's meant to be around 6 months of age that you introduce solids. And again, there'll be different influences there, but one would be walking down the supermarket aisle and seeing fruit and veg purees marketed for 4 months plus. Again, totally legal and also labelled no added sugar and other marketing slogans that are suggesting that it's a good choice. This is an appropriate choice for when you start giving your baby foods.
The Government's Scientific Advisory Committee on Nutrition recently produced a report on the diets of 1 to 5-year-olds in the UK. They found that on average, children were being given too many calories, sugars, proteins and salt, often in the form of commercial baby foods. The chair, Professor Ian Young, outlined their recommendations.
Firstly, sugars should not exceed 5% of total dietary energy intake. Should apply from age 1, so in all of the 1 to 3-year-olds. Secondly, that children aged 1 to 5 should not be given sugar-sweetened beverages at all. Thirdly, that dairy products such as yogurts and fromage frais, etc., given to children aged 1 to 5 should ideally be unsweetened. And fourthly, that formula milks, which includes infant formula, follow-on formula, growing up, other toddler-type milks, are not required by children aged 1 to 5 years. We also recommended that snack foods that are energy dense and high in saturated fat, salt or free sugars should be limited in children aged 1 to 5, which really means given as little as possible to children in that age group.
Unfortunately, our relationship with food is deep and complex. Bea Wilson is a food writer and co-founder of a charity that works to introduce fresh foods to children in schools. She told us her concern about the psychological effects of marketing tactics for foods aimed at children.
It tells us that the way that we express love is to give our child a treat, and that's an extremely powerful message because every parent ultimately wants two things. They want to see their child eat and they want to see their child made happy through food. And there's this problem with children's food, which is that there's a short-term thing, which is you want to see your child smile and have a full tummy, which is what happens today. And then there's a long-term thing of the person they're ultimately going to become. It's very, very hard for a parent to be thinking about that long-term thing when you've got a sad little face not wanting to eat what's in front of them. And I think unless we engage with this love relationship, which plays out through ultra-processed food, healthy eating initiatives run into difficulties.
Professor Young agreed.
In a personal capacity, I think it's critically important that children are introduced early to a wide range of foodstuffs, and in particular not introduced to sugary foodstuffs in early life, because it will develop a whole association of sugary sweet foods. It will alter the whole approach to diet in later life. So, I'd like to see sugars removed as much as possible from products aimed at those age groups.
Dr. Simpson again.
All socioeconomic status families use baby foods. It's completely the norm. And then that actually even continues in the first year of life, second year, third year of life. You've got products marketed for 12 months plus, 24 months plus. In the last year or so, we've seen a proliferation of products marketed for 36 months plus. They're all snacks, snack foods. They just basically look like crisps, but they're marketed for young children. And then you've got a whole set of products clearly aimed at preschool children because they have cartoon labels.
From the experts we heard from, it seemed clear that there is an important opportunity to avoid early weight and obesity issues in children through supporting families during pregnancy, infant feeding, and the early years. It is also an opportunity to set young children's food preferences in a healthy direction. In part 2 of this podcast, we will hear the evidence about what government policies might help. But first, what happens as children grow older and go to school? Once children are at school, there is the potential for breakfast clubs and school lunches to help ensure they get a healthy diet. We heard a lot about the issues with these, particularly in secondary schools. Caroline Woolham is an ambassador for the charity The Food Foundation.
They'd have like a mid-morning snack that was given to the children at no cost to the parent. So they would be given a piece of fruit or a pea snap or half a bagel. So that would be classed as a free snack in primary school.
Children from households with an annual income before benefits of less than £7,400 are offered what are known as free school meals. However, this doesn't mean that a nutritious meal is offered to these children for free. Dominic Watters, another ambassador for the Food Foundation, has a daughter at school on these so-called free school meals.
Free school meals aren't free. The amount awarded to each child is £3 a day. That hasn't changed since the 45-year fastest increase in the price of food, which places schools in problematic positions, especially around kind of the canteen and everything. I get a text at least every other week, if not a couple of times a week, saying, "Dad, can you top up my thumb?"
Children often pay for food at school using their thumbprint, and parents have to make sure they have enough money in their account to be able to buy lunch. And the food choices they have may not be healthy, especially given the money they have available. Naomi Duncan, Chief Executive of the charity Chefs in Schools.
A study by Imperial College found that around about 64% of the calories that kids were taking in from meals provided by the school were coming from ultra-processed food, and many of those were foods that were high in fat, sugar and salt. Much worse in secondary schools, I have to say, because of the kind of marketplace of food available.
Emmanuel is a member of the youth board at charity Bite Back.
I would have certain friends who, because of the amount of money that they were given as allowance for the day hadn't increased, but the prices of food in the canteen had increased with inflation, they would be trying to get more with less money. And because of that, they would then have to make decisions. Okay, am I going to eat at break time and then skip out lunch because I don't have enough money to get both? Or am I going to eat at lunch and then skip out break? And some of my friends would even message me the day before and be like, "Oh, Emmanuel, what lessons do we have in the morning? I just want to know if I've got PE in the morning so I know whether to get something at break time because I don't eat breakfast at home. So do I get something to eat at break time, which is then going to give me enough energy to get through PE and then I'll just skip out the rest of the day? Or do I soldier through up until about lunchtime and then get enough energy to get through my exam that I have period 5? And that was and still is the reality for a lot of young people in the UK.
For families struggling to afford good food in schools, the alternatives are packed lunches or nipping out to buy something locally from a fast food outlet, because time is short in the school break. Wendy Wills, Professor of Food and Public Health at the University of Hertfordshire, has been studying what typically happens.
In one of our studies of several hundred young people, around 40% of young people in more affluent areas were leaving school regularly, sort of more than twice a week, to go and purchase food or drink outside at lunchtime. But this was more than 90% of young people who were at schools that were in deprived neighbourhoods.
With more than 90% of school children going out of school to buy lunch, it sounds tempting to ban all outlets within walking distance. But if those outlets were not available near schools, Professor Wills told us they saw something else.
We saw a typical pattern where a young person might have a hot drink before they go to school, drink water at the mid-morning break, have an energy drink or another sort of high sugar drink at lunchtime, and have no food whatsoever during that part of the school day.
It seems as though some schools are failing to provide what their pupils need. But it's not all purely about food. We heard that there's a deeper, more social relationship involved.
In the schools that were in lower socioeconomic areas, the staff in food outlets around schools built up a really good relationship with young people. Young people were a really important part of that lunchtime economy, before, during and after school, actually. So they knew young people's families. They'd seen the children grow up. They were part of that sort of area, that neighbourhood. So it was more than just about buying the food.
Emmanuel explained.
The guy who owns the takeaway shop, I don't actually know his name, and I've been going to his takeaway shop for maybe the last, I'm 19, so I'll say around 17 years, but I always call him Bossman every time I enter into the shop, and that's just our way of communicating. Everyone in the community, they always call him Bossman. He's the local bossman who owns the pizza shop, and me and him, we have like a really, really good relationship, and that's because each and every time I go into his shop, I'm not just going there for food. These takeaway shops and fast food outlets are a social hub for the whole community to gather and talk.
An alternative for school children is to bring food in from home, a packed lunch. Unfortunately, we heard that these are also dominated by less healthy manufactured foods because of price, convenience, marketing, and peer pressure. Kathleen Kerridge, an ambassador for the Food Foundation, explained.
Marketing and influence around food, especially for school-aged children, matters very much. Because sending your kids to school with a healthy pasta salad or a rice salad or a turkey wrap, for example, will actually cause them to stand out from their peers somewhat. They don't want that. They want the name brand, bright, kids marketed stuff in their lunchbox. And mine were always very, very upset with me that they didn't get that, because I wouldn't buy it because of the price, I wouldn't buy it because of the ingredients, and they absolutely hated school lunchtime as a result of that.
Food manufacturers know well how to market their products to children, and also to target our desires for something convenient, affordable and tasty. Unfortunately, that doesn't take into account its effects on our health. Anna Taylor demonstrated the trade-off between health and price.
We looked at the 5 big supermarkets and we looked at all of their single pot yogurts. Cheapest product, 7 pence a pot. Look at the ingredients, which are highlighted there, quite a few of those ultra-processed. Next up, lower sugar, but 3 times the price, 21 pence a pot. That has half the amount of sugar than the cheapest one. So definitely good from health, but you're paying 3 times more. Your unsweetened one, 60 pence, so that's almost 10 times more expensive than the very cheapest one. If you're a parent and you've got a budget of maybe £50 a week for your family shop, these pennies really matter. You've got a tough set of choices. This is not working in your favour as a parent.
And it's not just the cost of buying the food. There's the costs of preparation to take into account. For those that have to watch every penny, we heard how they have to trade time and health for cost.
The shop on our estate, it doesn't sell anything fresh, so it's all the lowest quality processed food, white bread. It can be like a full-time occupation just to travel to get fresh food and ingredients.
Food Foundation Ambassador Dominic Waters again.
I'll be on my bus and I'll be hearing neighbours talking about how they spend all day on the buses with their free bus pass to get to different supermarkets to get the best deals on microwave meals. This is because as we're pay-as-you-go on gas and electric, we can see that the amount it costs to cook from scratch, I'm actually quite arguably a good cook, my daughter really likes my cooking, but to cook fresh ingredients from scratch, boiling, frying chicken, rice, pasta, we can see that it costs a lot more on your electric or gas than it does to cook a microwave meal.
Fast food retailers know this, and they specifically target those who need to keep costs down, making their food time and money saving. Youth Board member at Biteback, Anisha.
I literally live smack on the border between 2 neighbourhoods, Kilburn and West Hampstead. Now, turning left at the end of my road takes you into a much more deprived area, Kilburn, that is not exactly massively healthy. Every of the storefronts is either a fried chicken shop, or we might have a convenience store, a fast food outlet, or a burger joint. The streets are simply flooded with these unhealthy options lined up right next to one another. And in fact, within a few minutes walk, I can already count about 5 fried chicken shops and 4 fast food outlets. However, if I was to turn right at the end of my street, it takes me to the much more affluent West Hampstead, where there is an abundance of healthy food options and shops and restaurants, you name it. The only difference here, the irony here, is the fact that actually nothing in that area is actually affordable for the residents living in Kilburn.
Fellow Youth Board member, Harrison.
One thing you can't do is deny the tactic that these big junk food companies use to put this fat junk food as a starring role in my mind.
Yeah.
So as I walk to the bus stop, I see a McDonald's advert. As I get on the bus driving to uni, I look out on the streets, I see more adverts. It's literally, our high streets are flooded with junk food advertising. So why should we have to protect ourselves?
And Emmanuel.
During exam season, during A-levels, these big food corporations, they knew that I was doing exams. They knew the whole country was doing exams. And the amount of texts, emails, notifications I got on my phone, things I saw on social media about 2-for-1 deals for kids doing exams. If you come with your exam results, we'll give you a half-off deal or whatever. They know this, and they actively target young people, especially at times such as exam season, when young people and students are the most vulnerable. That's when they target you the hardest.
And this targeting has effects. Professor Vogel from City University again.
There's really some stark inequalities that are shown through data with childhood obesity, in particular children living in the most deprived areas being much more likely to be overweight and obese than children living in the most affluent areas. And that, again, that difference has almost doubled in the last 15 years, going from 9% to 17% difference over the 10 years of 2008 to 2019.
Everyone we heard from agreed that there is a big problem with the food that we're now being served by the food industry. Much of it is high in fat, salt and sugar and calorie dense. Some, though, see a further issue than just the nutrients in it, the way that those are processed. Ultra-processed food is a term that many of us will have started hearing recently. So what is it, and what, if anything, is the problem with it?
One way of thinking about ultra-processed food is that after the Second World War, we created a new form of farming that means that the cheapest forms of calories are refined vegetable oil, refined wheat, and refined sugar.
Henry Dimbleby again.
You can see ultra-processed food as a way of taking those cheap calories and making it palatable by adding as little other food as possible. And in some senses, that was a huge success. So we do not have the malnutrition as a form of farming was invented to stop. We have solved the calorie problem. And I think when you talk to older people in the food industry, they kind of think, how did I become the bad guy? Like, I was the hero. Like, through the 40s and 50s and 60s, we were the heroes. We solved this existential problem, and now we're the bad guys. But it is impossible not to draw the conclusion that actually the way in which that's developed is now causing huge harms.
It's not just the UK that's seen this rapid change in foodstuffs. It was particularly noticeable in South America, which is why it was researchers in Brazil who developed a classification called NOVA, which describes the level of processing of various foods, completely aside from the nutrients they contain. Professor Carlos Monteiro led the team.
NOVA classifies all foods we eat into 4 food groups. So this goes from the first group, where it's very easy to understand, are fresh or minimally processed foods, going to the 4th group, which is ultra-processed foods. So the first group is easy, is foods like they are produced in nature, or they are slightly modified without addition of anything. So frozen vegetables, pasteurized milk, anything. The second group is the group of processed culinary ingredients. So we are talking here about salt, sugar, oils, and fats. And why this group is important? Because it's with this group that people in their homes or in restaurants, they season, they cook, they prepare NOVA Group 1 foods. They are not consumed by themselves. The third group is made by the industry adding salt, sugar, oils, or fats to NOVA Group 1 foods. And these are, or could say, relatively simple and very old products, and they could be made by people at their homes. And traditional dietary patterns all over the world, since the Mediterranean diet until the Japanese diet, they are made from Group 1, 2, and 3. Of course, most Group 1, some Group 2, some Group 3. Ultra-processed food, which is the 4th group, is entirely different. They are not modified foods. You cannot identify one single whole food in these products. So they are formulations of different ingredients. In these ingredients, we have many food substances, so derived from foods like starches, like protein isolates, like oils and fats, and also additives, many additives.
In South America, we heard that these ultra-processed foods very quickly had a huge effect on people's diets.
In Chile, over 3 decades, we observe how most of the family spend money on natural foods, and then in 3 decades, most of the money was spent on ultra-processed food.
Professor Camila Corvalán from the Institute of Nutrition and Food Technology at the University of Chile.
And that was very related to the opening of our markets and the expansion of these big corporates, unfortunately, in the country. We could see at the same time that our obesity rates were increasing, our metabolic diseases, our cardiovascular diseases. So we had to take some action.
The suspicion was that the rise in obesity and diet-related diseases was linked to the rise in these foods. And they're very common in our diets in the UK, in children's lunchboxes and as convenient snacks and meals. Catherine Jenner is director of the Obesity Health Alliance, a group of 60 health-related organisations. She brought us some examples to show how we can recognise them from their ingredient lists and marketing.
I did a little trip to my local convenience store this morning on the way to the station. The first example here, these apple pie cookies that were on the shelf, very long-lasting, quite energy-dense products. It says that it's 25% apple, but when you read closely, it's 25% apple filling, of which only contains 5% actual apple. The rest is things like cornstarch, modified cornstarch, and stabilisers and various different ingredients. The next example I've got is this. It's a apple sauce, again, just like Mum used to make at home, a nice apple sauce, except I don't think your mother made it with potassium sorbate, glucose fructose syrup and modified cornstarch. And that is 25% sugar in that as well. It does contain some apples in it, at least.
In the UK, most of what we now eat is ultra-processed food. Anna Taylor from the Food Foundation again.
Actually, when you delve into different subsections of the population, you don't see huge amounts of difference. So no subgroup, whether they're older or younger, richer or poorer, living in the north or living in the south, has less than 50% of their calories from ultra-processed food. That's from the dietary data that we have. Ethnicity is a marker for slightly lower proportion, about 45%. But this is a majority experience. And then if you even dive into the data and you say, well, who are the lowest consumers? So the academics have looked at the spread and taken the lowest quarter. They're eating about 35% of their calories come from ultra-processed foods. The top quarter is about 75%.
And it starts very young. Dr. Vicky Simpson again.
We know that ultra-processed foods dominate diets from early in life. So one statistic drawing on the National Diet and Nutrition Survey data is that 61% of total mean energy intake of 2 to 5-year-olds in the UK come from UPFs.
And the reason that these sorts of foods have come to dominate our diets is quite simple. It's down to how the global food industry works. Dr. Rob Ralston, lecturer in public policy at the University of Edinburgh, explained.
Over the past 4 decades, the ultra-processed food industry has doubled in size, and it's now over $1.1 trillion. And within that industry, we see roughly 8 key corporations who hold very central positions, dominant positions within that industry, which are consumer brands that we're all familiar with. In terms of the influence of industry or why ultra-processed foods might be important within the portfolios of these companies is that they're very palatable, they have very long shelf lives, and they're also very highly marketable. What we've seen is multinational corporations devote huge sums of money to marketing ultra-processed foods. To give you an example, between 2015 and 2019, Nestle devoted about $100 billion just to marketing. And the reason that they're doing this and the reason ultra-processed foods are so important to these companies is simply that higher profits come from processed foods in comparison to, say, fresh foods or whole foods. So it's often not in the interests of corporations to promote healthier food products simply because the profit margins are lower and corporations have a fiduciary duty to shareholders to maximize profits.
Charlie Bigham, whose company makes food from fresh ingredients, emphasised that you don't have to use ultra-processed foods to make profits, but they might be low without them.
Our profit margins are matter of public record because we're a limited company, so they're available at companies' house. And you will see that we don't make the same levels of profit that a large global business might make, global food business.
The global food businesses that dominate our diets in the UK predominantly sell the more profitable ultra-processed foods, or UPFs. The rise of these coincides with the rise of food-related health problems in many countries, and there's good evidence that the rises are directly linked. But what is causing that effect? What is it that makes food healthy or unhealthy? Is it the level of nutrients, being high in fat, salt and sugar, known as HFSS? Is it the synthetic ingredients like additives? Or is it something about the processing? Our experts generally agree the current definition, which is based on nutrient content, is well supported by the evidence. But there is still a live debate over the relative contributions of these nutrients, processing and additives in the healthiness of individual foods. Professor Robinson again.
There is significant overlap, and lots of the foods that we think of as junk food would fall into both the HFSS category and the UPF category. But the reason the distinction is important is because there's a number of UPFs that would not be classed as HFSS. Supermarket bread, whether that's wholemeal or white, would be a UPF, but it wouldn't be HFSS.
Foods that are HFSS, high in fat, salt and sugar, are already not recommended as part of a healthy diet, and the government regulates how they're marketed because there is good evidence on how they cause health problems. Senior nutritional epidemiologist at the University of Oxford, Dr. Karen Papia.
We know very well about sodium and salt and its impacts on our blood pressure and cardiovascular disease risks, and also saturated fat, increasing lipids, and cardiovascular disease. We have evidence around processed meat and colorectal cancer. I mean, the list really does go on.
But does ultra-processed food, UPF, that doesn't contain high fat, salt and sugar still cause problems in our diets? One issue that has been raised is what they don't contain, and hence what we might miss out on if we replace whole foods with UPFs. Catherine Jenner from the Obesity Health Alliance again.
The biggest evidence for me around UPF is around the lack of fibre, which slows down the digestion of it, the fact that they may use less healthy ingredients to bulk it out, therefore pushing out more nutrients from the food.
Then there's the fact that in many cases, foods classed as UPF contain a lot of calories per portion. And we also heard about emerging evidence that they are manufactured to be especially tasty, something called hyperpalatability. Tim Spector, Professor of Genetic Epidemiology at King's College London.
There's a researcher in Kansas called Dr. Fazido who looked at a large number of studies in the US that dealt with hyperpalatability, and from that used the US database to work out there were 3 outstanding ratios of food that the industry used to make their food hyperpalatable. 25% of calories from fat plus 0.3% of sodium, 20% of calories from fat plus 20% from sugars, and 40% from carbs and 0.2% of sodium. So these are very precise measures that are quite easy to put out there. And these making foods designed specifically so that people will overeat them.
But we heard about more subtle issues that UPFs might be causing. The combinations of fats, sugars, carbohydrates and salts that are put together, often along with additives, may have unexpected effects on our bodies because they are not combinations our bodies have evolved to deal with. Professor Barry Smith, Director of the Centre for the Study of the Senses at the University of London, described some examples.
When we're getting those artificial sweeteners, our bodies are then thinking they're going to get sugar, no sugar comes, and if you're taking carbohydrates at the same time, having a diet Pepsi, say, with a fatty lunch, the body will start storing that fat more because it's getting a signal that it was going to get a lot of that energy, didn't get it, and then it starts trying to find it, chase the calories. But again, The problem is we used to have ordinary systems that told us what was in our food and helped us regulate when we were getting it, and we could stop. So what we're doing is tampering with those systems, bypassing them in some way, and that's not good.
Then, some of the additives themselves may be bad for us. Dr. Mathilde Touvier, head of the Nutritional Epidemiology Research Team at French Governmental Research Institute in Sermes.
We've been able, for the first time at the international level, to measure the additive exposure to a wide range of food additives. And we've showed associations between a higher intake of several artificial sweeteners, several preservatives such as nitrites, and also some food emulsifiers, and a higher risk of different diseases. So hypertension, cardiovascular diseases, type 2 diabetes, some cancers.
We heard from the Chief Scientific Advisor to the Food Standards Agency, or FSA, Professor Robin May. He told us about the issues with testing the safety of additives, like emulsifiers and preservatives.
In terms of new products, so additives in particular, which are the things that extend shelf life, so any product has to come to the FSA as a regulator, and we look at possible DNA damage, liver impacts, kidney impacts. So I think I can hand on heart, so those individual components are very carefully assessed and safe. What no regulator, no science base anywhere in the world, as far as I'm aware, has achieved yet is the ability to look at them in the full complexity of all the different components in there. And that essentially is a problem of scale. So in the United Kingdom, we have something in the order of 320 licensed additives. So even if you only had 2 additives always at the same concentration in a food, you're looking at something like 100,000 combinations that would need testing. So the scale is really quite overwhelming.
It's clearly very difficult to pin down how much the link between high amounts of ultra-processed food in our diets and high levels of obesity and ill health is down to the fats, salts and sugars, and how much to something else. What is needed is actual experiments. And the most famous experiment done so far is one led by Dr. Kevin Hall, senior investigator at the National Institutes of Health, the US government research body. They divided volunteers into 2 groups. Both groups were allowed to eat as much or as little as they liked, and they were offered a diet that had the same calorie density, salt, sugar, fat, and fibre content, and glycemic load. The difference was that for one group it was all ultra-processed, and for the other group none of it was, and then the 2 groups swapped over.
The surprise to me was that despite matching for the various nutrients of concern that we matched for, that people spontaneously chose to eat many more calories on the ultra-processed diet, gaining weight and gaining body fat, whereas when the same people were exposed to a food environment that had no ultra-processed foods but were matched for various nutrients of concern, they spontaneously lost weight and lost body fat.
Dr. Hall's team admit that this was only a first study and was small, and there were differences in the diets that need to be teased apart, such as using drinks within the diets to help make up the nutrient numbers. They are following up that initial study with others now to try to identify potential causes for the effects he saw.
We need some real devotion to some research to really try to figure out what are the main factors in our food environment that drive us to overconsume calories and gain weight and have all of the downstream consequences of obesity, as well as some of these other independent factors of ultra-processed foods that may lead to other deleterious health consequences, whether that be through systemic inflammation, whether it be changes in the gut microbiome, et cetera, et cetera. That mechanistic information, I think, is crucial. It doesn't mean that we can't act now from a policy perspective, but I think to act most effectively, one needs to understand the mechanisms as well as the potential consequences of interventions in terms of what it's being replaced with.
Given the need for further research into exactly what the link is between industrialised diets and poor health, and if the label ultra-processed can't be used to reliably categorise individual foodstuffs in a black and white manner, where does this leave us in terms of policy making? Many experts we heard from reflected on whether defining individual products as ultra-processed or not was practical or even useful. Dr. Van Tulleken.
It's important to say that the definition of ultra-processed food wasn't developed as a consumer tool. It wasn't developed as a policy instrument. It was a definition developed in order to test a hypothesis that came out of data, that a paradox was observed, that families in South and Central America that were buying more oil and more sugar were healthier than families that weren't. And so the scientists in Brazil, led by Carlos Monteiro and his team, they created a definition to describe this new influx of food that had broadly followed the North American Free Trade Agreement and had driven this very rapid expansion of diet-related disease, where in a single generation, obesity went from being really almost unheard of to being the dominant public health problem. So that was where the definition started. It was to try and delineate this very big category of diverse foods.
Susan Jebb, Professor of Diet and Population Health at the University of Oxford.
The key point that I'd make is that ultra-processed food is a very binary system, yes or no, and that means we can spend an awful lot of time arguing which side of the line a particular food will fall. Some of the research on ultra-processed food is beginning to try to look at specific categories of food, but to be honest, I think we're a very long way off being able to link individual foods to particular health outcomes, so I think it is quite challenging. My worry, I suppose, is if we throw out the HFSS nutrient profiling model in favour of UPF as the basis for our food policy, is that we're going to spend another however many years trying to agree the definition.
Dr. Van Tulleken again.
We need to do more research, absolutely. However, we are at a moment where I think whether you believe on the evidence on ultra-processed food is sort of irrelevant, because the regulatory tool, in my view, should be fat, salt, sugar and calories, and we all agree on that, and we know there's this catastrophic tragedy that we've been living with for 2-3 decades. We should definitely do more research. We don't need to wait for more research before we act.
So although we do need research into the health effects of additives and ultra-processed foods, that shouldn't be an excuse for lack of action now. But with less healthy foods often being the cheapest and most convenient, how can the government best take action without making life very difficult for people? In the next episode, we've pulled together some of the evidence we heard from experts around the world, including from within the food industry itself, on what action the government might take. There are opportunities to break the cycle of increasing ill health and cost to society, and many in the food industry are calling for urgent action. You can also find our report, Recipe for Health, a plan to fix our broken food system, online, for more details about all the evidence we heard and our recommendations to government.